All right, let's talk about healthcare. And I think the first thing people think about when it comes to healthcare, a great healthcare worldwide, is they think about Canada. Could be one of the first few things someone mentions about Canada. You ask someone in New Zealand, what do you know about Canada? They'll talk about the healthcare. You ask anyone in Asia, many people in Europe, South America, what do you know about Canada? They probably will list maybe hockey, maybe Niagara Falls, and then healthcare. Probably healthcare before the other two things. Now, I've been, in Canada for pretty much my entire life, since the 80s and, the mid 80s. And, we have this thing where, we're told Canada has a great healthcare system, but is it really the case? According to the CBC News article, they found that over 6 million Canadians don't have a doctor, right? So how could you label your healthcare system so great when you have 6 million people, that's about 1/8 of the Canadian population, don't have a doctor. They don't see a doctor, right? And I totally get it. I have had a doctor, a family doctor, for about 1 year out of the last 8 years. I find the walk-in clinics to be a bit better, right? They're open like 7 days a week, open pretty late. You can go anytime. You don't have to like plan it. Whereas you try to call your doctor to book an appointment, you're waiting in line. The next available slot is 2 weeks later. So like, how are they going to cure you if you're going to see them in 2 weeks, right? So I've been feeling for a while that the Canadian healthcare system isn't as good as people think it is. We're told it. People are brainwashed to think it. But really, have you asked yourself, is it a really good healthcare system? I don't think so. How many times have you heard, you know what, every time something happens, and, it's obviously not a good thing when it happens, but if one of my daughters are sick and, I look, pretty, excessively sick, my wife was like, let's take him to the hospital, take her to the hospital. And I'm like, do I want to literally lose the next 12 hours of my life? Like, that's how I feel. And I've gone to the ER maybe 2 or 3 times in the last few years. And each time it was like literally probably the 6 hours was the earliest I was able to get out of there. And sometimes it's like crossing 8, 10, 12 hours, right? So I don't know. I'm not really thinking that Canada has a good healthcare system. Really think about it. And the funny thing is, free healthcare isn't like Canada's only country in the world. Canada's probably one out of, I think, pretty much every single Western country, considered first world countries, quote unquote, do have free healthcare. And I think maybe America might be the only one that doesn't have universal healthcare, right? So I think Canada is part of many countries, if not maybe most countries. Many countries in the Middle East have it. Europe pretty much has it. In Europe, I think many of the countries, the doctors come to your home, right? And here we are having to wait 8 hours to go in the ER, right? You pay like $20 for parking. It's just, I don't think it's a good system. I had a uncle who was a doctor, and he mentioned something interesting. He mentioned, he spent most of his time working at a clinic. Actually, it was a medical clinic, and most of his clients, he did have family physician clients, but he spent a lot of the time basically doing walk-in. And he was talking about all of the ridiculous things he has to see, right? Because it's free healthcare, people go there for the stupidest things. And he was saying, like, if the government charged a $10 deductible, meaning you can go, it's pretty much free, you just pay $10. I think that eliminates most of the problems, right? You make it where it's absolutely free and people, just abuse the system, charging a nominal fee of $10, $5 even. I think that probably fixes a lot of the healthcare system. What do you guys think? I think it's pretty ridiculous for us. People think that we have a great healthcare system when 6 million Canadians don't have a doctor, right? A family doctor. Many people are like me where they don't see a family doctor. They rather go to a walk-in clinic. And then you have a ridiculous times, the hospital. Medicine is expensive, unless you are covered by a plan, or you're under a certain age or under a certain income bracket, and which only was added the last few years, right? Most people have to pay for medicine. So I think there's a lot to be desired with the Canadian healthcare system.